Welcome back to Overhead Athletics. Today we're talking about cervical spine. And in our young patients, a lot of times we get a cervical spine, especially in the upper cervical spine around C2, that we actually want to manipulate. We generally don't do manipulations of the cervical spine in the presence of arthritis, any sort of vascular conditions, high blood pressure, known history of arteriosclerosis. But if we have a young athletic individual with stiff side bending or rotation to one side, that may be a neck that we manipulate. We're going to test our joint play throughout the entire cervical spine in side bending. We don't advise a rotational manipulation where we take the individual to the end of their range and then apply a large amplitude, although some individuals in manipulative medicine may call that a small amplitude thrust. We call that a large amplitude rotational maneuver. And that's what puts tensile load on one side of the vertebral artery in the V2 segment, can lead to a dissection of the vertebral artery and an ensuing stroke. What we do for our manipulations is we give a straight thrust into side bending with a little pre-positioning into extension and side bending. So we side bend him towards us using our manipulative hand or our thrust hand, extend him, and then we direct our force in line with that vertebral segment. Simply put, just like that. And we can demonstrate the other side here. This is a very safe technique because we're not introducing rotation at the end of the range of motion. We can follow this up with cervical traction if we wish, but the idea being here, we can restore rotation and side bending to the upper cervical spine, which will take load off the mid-cervical spine, which we often see as hypermobile and unstable, leading to radicular symptoms and neck pain in many of our athletes. I actually have multiple athletes on schedule right now, 2 baseball players, one with a cervical radiculopathy and one with cervical pain, coming at the C5, C6 segment.